Hello, hi, and namaste. Welcome you all to our new episode of Health Heroes of India. Today, we are going to discuss a topic which is knee pain. To discuss about the topic and to know more about the knee pain, we have today invited our guest, Dr. Anil Kumar Nathi. Dr. Anil Kumar Nathi have more than 17 years experience in the field of orthopedic and joint replacement. He has done many successful surgeries of joint replacement and complex fractures. So let's welcome him to our podcast. Sir, welcome you to our podcast.
Thank you for inviting me to this podcast. Thank you, Biswaranjan.
Thank you, sir.
I'm honored to be here and discuss common myths, facts about knee pains, and give some awareness to the best of my knowledge.
Thank you, sir. So, sir, knee pain right now, it's a very common thing, and people are suffering, maximum people are suffering with the knee pain. So, what do you feel? What are the causes of knee pain?
Yeah, knee pain is a multifactorial thing. There are many causes. Knee pain has been common in elderly people, and that is everyone knows that there is osteoarthritis. This osteoarthritis can be due to degenerative disease, which is an aging process,
Yes.
or post injury, because injury prone joints will be having arthritis at an early age, or they are inflammatory diseases which damage the knee joint and cause arthritis. So arthritis is one of the common cause. It's commonly called as arthritis. Everyone has some pain. Everyone thinks that it's because of arthritis.
Okay.
But a lot of other causes are there. Apart from injuries,
Yes.
usually muscle weakness and repetitive stress disorders, like people keep on using their knees in a fixed posture, that will cause strain on the knee, and this cumulative strain every day will cause knee pains.
Okay.
And apart from that, medical conditions like thyroid problems, diabetes, and increased uric acid in kidney patients,
Okay.
kidney problem patients,
Okay.
and most of the medical conditions which are caused by inflammatory arthritis like rheumatoid arthritis,
Okay.
and systemic lupus erythematosus, and gout. These all are medical conditions which cause knee pain. In young people, if they have muscle weakness, then these kind of muscle weaknesses, particularly surrounding the knee, weakness in the anterior cartilage of the kneecap,
Okay.
that is called patellofemoral pain syndrome, and it is also called as chondromalacia patella, which is mostly seen in women, postmenopausal women, and obesity is another cause where most of the load is transferred to the knee joints. And apart from the regular pains, particularly to the knee, there are other pains which were radiating from spine. If there is a problem in the spine, there will be a referred pain to the knee. The same way, if there is a problem in the hip, that will be referred to the knee. So thorough examination, clinical examination will help us to diagnose what is the exact cause of the knee pain.
So basically, we have few causes. That means one is pathological causes, one is medical causes, and another is your aging. Aging also one factor.
Repetitive stress.
Repetitive stress and obesity.
Yes.
And another is the referred pain.
Referred pain and wrong posture.
Wrong posture. Okay. So just now you told that you have to do the clinical examinations. So what are the source or causes of pain you have discussed? So in your point of view, what are the source of knee pain and how do you diagnose it?
Yeah, a very good question. Usually people come with different kinds of opinions and their own way of thinking. Yes. About their own knee pain.
Yes.
So the responsibility of the doctor is to exactly diagnose where and what is the problem causing this knee pain. So for that, we need to take a proper history what is the starting point?
Okay.
So once we take a proper history, we need to do a thorough and proper full body clinical examination.
Okay.
If we do that, we will find out some possibilities, or you call it as differential diagnosis, and we work on it, and depending upon that, as and when required, we will order an investigation.
Okay.
Like suppose if there is a knee pain,
Mhm.
after clinical examination, we think the pain is locally at the knee.
Okay.
Then we will order investigations pertaining to that knee joint.
Okay.
Depending upon if there is an inflammatory, then we will order usual blood investigations. And also, it is not like a full body, but it's a full length X-rays to see whether the alignment is good, whether the joint function is proper. So if in X-ray we couldn't find anything, but still in our clinical examination we think that it is something else which is related to the ligaments or the meniscus or the synovium, which is the inner covering, so then we will go for a magnetic resonance imaging,
MRI.
this MRI. Only as and when required is MRI is ordered. MRI should not be ordered as frequently as we can. There are certain protocols where we need to go for an MRI, and this MRI we correlate it with clinically.
Mhm.
We first see the patient and then correlate it with an MRI. It's not like seeing the MRI and going back and seeing the patient.
Okay.
Initial assessment is more important. Once we examine and come to a conclusion that these might be the causes of his or her knee pain, then we will order an X-ray or an MRI or sometimes a CT scan or a radionuclide scans. These all are only correlated with the initial proper clinical examination. Without clinical examination, we can never find what is the exact cause. So history, person can tell anything, but we need to pick what is relevant.
Yes.
And then we need to build upon that and come to a final diagnosis. Usually when patient comes, he will be in a hurry.
Yes.
Doctor also will be in a hurry. Both are in a timeless zone in these running fast days.
Yes.
There are n number of chances to miss a problem. So patient should be very quiet and calm with less apprehension, and then the doctor should spend much time in diagnosing his clinical problem with all his experience and do the exact thing.
Okay, sir. Sir, just you mentioned MRI and CT scan. I have a small doubt. When you refer a patient for MRI and when the patient should go for a CT scan?
Yeah,
What is the
it's a
difference
simple thing is for bone. Bone usually we take CT scans.
CT scan.
Yeah, for the
Okay.
soft tissue like the muscles, the ligaments, the synovium, the cartilage.
Okay.
These are best seen with MRI.
MRI.
Even an X-ray can find out indirect problems, but the most sensitive one till date we have is an MRI. But that should be ordered if we have a plan in your mind.
What kind of
Simply,
plan?
we don't need to order an MRI. We need to order an MRI as and when required. If the information of initial investigations were not enough and you feel that this investigation might benefit him, then we can order an MRI.
Okay. So CT scan is only for the bone.
Yeah, bone.
Bone means heart.
Because CT scan is nothing but multiple X-rays at a single slice.
Okay.
So that gives you a 3D picture of the entire bone. It also gives picture of soft tissue indirectly.
Okay.
But the direct thing for the soft tissue is magnetic resonance imaging.
It is MRI.
MRI.
So first, if it is a fracture is visible, then you can go for X-ray.
Yeah.
I'm telling why, because our main aim and objective is to spread the awareness.
Yeah.
So if it is visible, fracture is visible, to get it more confirmed, so you can go for X-ray.
Yeah. X-rays also should be taken full length. That
Okay.
means any bone will be fractured at either middle or at the joints. Joint fractures are always more dangerous and are missed a lot. If you don't take a proper x-ray, suppose if you have a fracture in the hand, the wrist joint and the elbow joint should be included, so that you will because this is an entire bone.
Yes.
The energy will be transmitted from here to down, or from here to the elbow. But we never know. Clinically, we need to first see, then see both the joints and order a full x-ray. So then, if needed, joint fractures will usually again re-evaluated with a CT scan to get a three-dimensional picture. X-ray is a two-dimensional picture. So CT scan is a three-dimensional picture. And MRI gives you the whole lot along with the soft tissues, the muscles, the ligaments, the nerves, the blood vessels, everything.
Before, if it is a patient comes to you with knee pain, so you directly go for surgery, or is there any non-surgical treatment you should tell the patient?
Yeah. When a patient comes with a problem, we analyze it, we come to a diagnosis. We always should try non-surgical, non-invasive options, whichever are present.
Yes.
Because every problem doesn't need a surgery. Surgery is needed when and only when the conservative management fails and he has severe rest pain, and the options which we have tried are not working. So in those kinds, we usually suggest surgery. Saying so, in this busy world, there is a lot of miscommunication between doctors treating the patient and the patient having multiple opinions. So this gap can never be bridged unless otherwise we are doing these kind of podcasts in making awareness, giving genuine information, and not only giving genuine information, breaking the myths and making the facts imprinted to the large volume of patients. So then only this miscommunication will go. Or else misinterpretation will always cause us anxiety because patient is suffering. He doesn't know about what the problem is. So he consults many people, and many people will give different opinions. He is confused what to take, which one to trust, and he will be in a turmoil where he can never rely on a single person, and he will be having multiple doubts. If the patient doesn't take multiple opinions, rely on a very good physician and then go accordingly, then things will be little less burdened for the patient. So there are many non-surgical options. Before we go for a surgery, we need to try it, because many non-surgical options will work a lot better. So we will see what is the main cause of the knee pain. Either it is because of the posture, we will advise them to correct the posture. See, suppose if a person is doing a work with a single posture, with locking the knees, standing in a different directions for hours together, that causes repetitive stress. Unless he changes that posture, he can never have the problem solved. Only when he can change the posture and then he corrects it, then only the main problem will come down. We can give painkillers, but that's not the solution. The solution is to identify the exact problem and to negate it with whatever possible ways we can. Coming to other modalities of treatment, we can strengthen the muscles by asking them to do exercises, targeted exercises for the knee, like cycling, resistance cycling, and then swimming, and then many ways like weighted exercises, squats. Walking is absolutely fine, but when you need to increase the strength of the muscles, you need a targeted knee exercise protocol, where and when only your knee muscle will go to the next level, or else the strength in walking is okay for the muscles to keep the maintain the tone and everything. But when you want to improve the particular muscle strengthening of particular muscles, then you need to do a targeted based exercises. Apart from that, physical therapy, do exercises on their own. If not possible, then go to a physiotherapy center, do targeted exercises. There are multimodal treatment options like electrical stimulation, cryotherapy, hydrotherapy. Whatever we do, we should assist our body in such a way that that problem will slowly heal to 90%. If there is 90% of pain relief, they can exercise back again. The problem is when they have pain, they stop moving the knee joint. That causes muscle weakness. That in turn causes pain again. This becomes a vicious cycle. So before going for surgery, we need to try all modalities of non-surgical options.
Thank you, sir. Sir, as discussed earlier, due to the alignment also, the proximal joints or distal joints, if they involve or there is some misalignment on the proximal joint or distal joint of the body, you may get knee pain.
Yes.
So, if a patient suffering with flat feet or high covers feet, is there any chances they will suffer with knee pain in later stage of their life?
Yeah. See, we stand upright and the center of gravity
Yes.
will depend upon the alignment of both the lower limbs.
Yes.
That is from the hip joint, knee joint, ankle joint. That will be aligned. That will be particularly aligned for particular patient. So if a person has a flat foot and then there is a deformity, increased deformity, the ankles will be deformed first. That will change the loading on the knee.
Yes.
The loading will be different. If there is only single flat foot, the loading will be different on that side of the knee and the loading will be different on the other side of the knee. If there is both flat foot, then the alignment will be different. If the alignment is not according to the regular standards, then definitely because of the malalignment of the lower limb, they get knee pains.
Yes.
So the primary problem is in the feet or the ankle. That causes the secondary problem in the knee. That is the main problem we need to diagnose, and then we need to prescribe proper orthotics for flat feet and then correct it to realign the entire lower limb. Or sometimes that will be anatomical, then we need to assure them, and if there is no problems, we can just leave them like that.
Okay.
Or else we need to correct the primary problem.
Yes. First, treat the primary problem.
We need to treat the primary problem, then the secondary problem will be treated.
So nowadays, people are more obese, and I saw many patients those are suffering with knee pain. Maximum obesity patients are coming to us for any small treatment, or they referred by the doctors, or they may be coming to you. So why the obesity? Those who are obese, they are suffering with knee pain more.
Yeah, obesity plays an important role in osteoarthritis. Obesity will causes increased joint stress, particularly if the body weight is increasing. The knee joint supports to an extent where beyond that, the cartilage will be loaded in such a way that small breaks in the cartilage happens.
Okay.
These small breaks every day with the repetitive stress on the knee joint because of the ground reaction forces and the weight on which the joint is day by day having multiple cartilage breaks will cause eventually osteoarthritis. Definitely, obesity will load the joint in such a way that every day you load a joint, the cartilage breaks, the bone gets swollen, then cytokines were released in the reparative process, and they get pain. Because of the pain, they stop using their knee muscles. their knee muscles will again get weakened, and this cycle goes on, not in a single day, continuously. Because of that, this repetitive process, which is a stress to the joint, will cause osteoarthritis in an early age. So, research says that 20% of reduction in the body weight will reduce the stress more than 50%.
Okay.
So, our target should be fit with good knee musculature. We need to do some sort of exercises at least 3 times a week. Cycling exercises are the one which helps us, and if possible, swimming can help us in cardiac and also the targeted knee exercises.
Sir, what are the targeted knee exercises? Could you say
Targeted knee
something?
exercises are, in a simple way, we have muscles in the front part, muscles in the back part. So these muscles have unique functions where if we target the anterior group of muscles, it will make the knee strong in making it straight.
Okay.
If we strengthen the back muscles, it will help the knee when it is bent beyond 90 degrees, and it will help in bending the knee.
Okay.
So we need all kind of muscles working in synergy all together in a simple manner, so that the kinematics of the knee, I mean to say the function of the knee, will be normal. So every person will have knee functions in such a way that he will be driven by the daily activities. He walks, he runs, he climbs, he jumps. So all these forces should be negated with the strong muscles. If you have strong muscles, you will have strong joints.
Yes.
So in order to maintain the strong joints, you need to have a very good body mass index. So if you are overweight, we need to target our overweight and do exercises, take a proper diet, take multiple antioxidants, and then increase the health of the joint. Increasing the health of the joint by increasing the overall health of the body
Yes.
is the need of the hour.
Thank you, sir. Sir, now many patients comes to you, and they come with a knee pain, and they come for the consultation to you. You suggest something, they take it casually, or in many way they don't come, or they don't come for the follow up next time, and it is untreated. So, what are the impacts if it is untreated? Knee pain, early signs, symptoms, if it is there, if it is untreated, what are the impacts the first patient will face in future?
Yeah. Whatever health problems we have, self neglect regarding that health issue is more dangerous. First of all, we need to understand our problem. For that, we need to ask the doctor, treating doctor, of whatever things we need to do from our side to decrease this pain. See, doctor alone can't treat the problem. Problem is multifactorial.
Yes.
So, in this course of the treatment, doctor will suggest some things. He prescribes medications. He asks the patient to do some exercises, and collectively, these all things will give 100% result.
Yes.
Just the prescription of the doctor doesn't solve the problem. It only helps you.
Yes.
So you need to note down each and every point, whichever the doctor suggests you. Take it seriously because it is your health, not the doctor's health. So you need to take that point into very serious focus and focus on the problem, then do the exercises.
What are the risks involved if it's not treated?
If it is untreated, like they neglect it for prolonged time, suppose say 6 months, they will live with that pain. Their emotional pain will increase, their mobility will decrease, their social communications and social mingling will come down. So this in turn will cause mental ill health. See, health is a holistic thing. You need to be sound in mind and body. So if you need a sound mind and body, the function whichever is lost, by any way you need to try to get it back.
Yes.
Whether you get it 80%, whether you get it 90%, you need to try from your side, take the help of the physician who is treating, and then come out of the problem. You need to fight it back in such a way that you should never just settle with low. You need to conquer it. You need to go to the next level.
Yes.
Then only these problems, whichever arise in your knee or whatever joint, will get healed. See, healing is within your body, and if you don't take it into focus and neglect it, this becomes a chronic problem. This becomes a burden to you, to your family, and in turn to the entire society.
Yes.
So you will be unproductive. You will not have good health, both in body and mind. Then eventually the people surrounding you will also feel bad about it, and their synchrony with you also will get lost.
Yes.
So whatever problems we have, we need to address it and conquer it. It is in you.
Yes. Another thing is that if it is knee pain is untreated, it might in future patient may get deformity also, sir.
Yes, sure. That's
Patient
what
may
I
get
am telling. Loss
deformity.
of function,
Functions,
Yeah.
deformity and impaired
gait,
gait and impaired
and
lifestyle also.
impaired. Many functions will be lost. He can't walk. He can't run. He can't go to the outstations. He can't go to any new places to see. He can't drive. There are many number of things which we do in our daily life. He will miss everything.
Yes. Yes.